We at Human Network International, we're a service provider, and we help organizations to implement better. And so therefore, we're not out on the front line, we're not in health facilities, but we're speaking to people that are, and we're helping them to integrate information communication technology to do what they want to do better. Okay, great. First slide, please. So what do we do at H&I? We've got something called the 321 service, which I'll talk more about. And we also do mobile data collection, mobile surveys, can you go back? And fully customized interactive voice response, SMS, USSD work. So the need that I want to talk about today is information access. So the internet in Africa is still a struggle. Smartphones remain expensive. The cost of data remains high. And 60% of Africans will not have access to the internet by the end of the decade. We also need to think about literacy in this. So over 54% of rural women, 40% of rural men have no formal education. So only 9% of women read a newspaper. I think that says 35% watch television and 39% listen to the radio at least once a week. That's actually very low. So where are people getting their health information from? Only 7% of women have access to all of these media at least once a week. We also need to think about how this breaks down in rural and urban areas. Those in urban areas have much better access to information. So ultimately, we're sort of failing rural women here. Next slide, please. So what's the solution? How can we engage this demographic? 88% of the African population lives under a cell phone signal. And of the 722 million connections that are currently running on the continent today, 500 million of these are running on dumb phones. And when I say dumb phones, I'm talking about this $5 Nokia with a torch. I'm sure you're all familiar. They're everywhere. So how can we leverage these to better reach people with good health information? So what I want to talk about now is the 321 service. It's a private-public partnership between ourselves and Airtel here in Nigeria. We work with different mobile network operators in different countries. And it's effectively a free, on-demand information service. The caller is the decision maker. So let's take a rural woman. She lives in the north. She only speaks Hausa. She's never been to school. Her nearest health facility is far away. Perhaps it's risky or dangerous for her to be asking about family planning. What can she do? Well, she can take that basic $5 Nokia that's owned by her or her household. She can call 321, that's why the service is called 321, and she can listen and choose from a bunch of options. So first of all, she'll select her language. We work in Yoruba, Hausa, Pidgin, Igbo, English. 95% of Nigerians speak at least one of these languages. Would you like to know about health? Press 1. Would you like to know about nutrition? Press 2. Would you like to know about family planning? And so on and so forth. So she'll navigate her way through the menu until she hits the key message that she wants to listen to. So each message is designed to be easy to understand and actionable. So we want to link people to services. It's taking it to the next step. It's not just telling people what they should be doing, it's then directing them to where they can find what they need. It's a very interesting behavior change communication tool because it empowers people to proactively pull information in their time of need. It's anonymous, and ultimately we're thinking outside the box here, leveraging private-public partnerships to create sustainability. And this is about demand creation, so getting people and educating people about their health and getting them to the services that lots of you in this room are creating. So it's real-time analytics, so we can see exactly who's calling and what they're listening to. This is really, really important. And also we can follow up with callers, and we can be building in questions to check their understanding of what they've been listening to, and to ask them then if they're going to make changes in their behavior as a result of it. So, measuring impact, we recently had GSMA here studying the 321 service. GSMA is the Association of Telecoms, as some of you may know, and they funded the nutrition content here in Nigeria. And basically they found that users expressed great enthusiasm for the service. They thought it was trustworthy, and they found it very, very educational. And basically, this slide's pretty interesting. We found that 55% of people who are calling 321 to get health information, there are other topics on there as well, said that they simply couldn't get this information anywhere else. So we had 10% saying that they can get this from their doctor. We've got about 3%, I think it is, saying that they get this information from their health center. We've got a whopping 30% of people saying that they do get information from media that we discuss, TV, radio, newspapers. We've got only 1% of people seeking information from their spouses, which I thought was incredibly low, and 55% identifying 321 as the only way that they can get good, trusted health information. So why does Airtel do all of this? It makes good business sense for them, and this is where the sustainability component comes in, and this is something I think we all really need to think about in the business of healthcare in Nigeria, making services sustainable and not dependent on donor money. So no one is paying the airtime bill for 321. So it decreases churn. People keep their Airtel SIM cards because they like being able to call 321, and it increases the average revenue per user. So I'll wrap it up. I want to keep it brief. There is a lot more that I could talk about. There are other things that we do here in Nigeria, such as commodity tracking and supply chain management, reporting hotlines and things, seeking feedback from the end users. How are their services? What do they need? What needs to be done better in these health facilities? But I wanted, as I said, to really just get you thinking about demand creation. It's pointless creating great health services if we're not getting people to them. I wanted you to think about private-public partnerships and leveraging these, sustainability, and integrating ICT into your programming and getting people to the services. Thank you. And the idea is, you can be a rural lady who lives in the middle of nowhere. You can take that basic $5 phone that you own. You can call 321. That's why the service is called 321. It's free. It's all interactive voice response. It doesn't matter that you're low to no literacy, you can still leverage the service, and you can call and listen to great information on health, nutrition, agriculture, WASH, family planning, financial inclusion, and so on and so forth. The really interesting thing about 321 is that it's sustainable. So Airtel gives us all of the minutes for free. The model is 10 free calls a month, with the 11th call and on, priced at a flat rate of 10 naira, which is below market rates. And they don't do this out of the goodness of their hearts entirely. They do it because people keep their Airtel SIMs because they really like the ability to call 321. They see a great deal of value in the service. They love the content. And it actually increases the average revenue per user. And GSMA, who are the Association of Telecoms, have done quite a lot of research on this to try and understand why it is that those maybe who weren't using their phones very much before are actually spending more a month. And we think it's literally as simple as someone, gets familiar with calling 321 for free, and then they're much more likely to call their friend, who lives in the next village. So that is why 321 is sustainable and will continue to run. It offers a really great value proposition for the mobile network operator. We've got 321 up and running in many countries across Africa. We work with different mobile network operators in different countries.